A question I often get asked is, how do I prevent scarring when I get a wound? It could be a surgical wound, it could be a traumatic wound, it could be a scrape. Whatever it is, there's actually a couple very simple rules to prevent scarring as much as possible. It's impossible to guarantee that no scarring will happen, but certainly doing some of these steps will prevent it from being more obvious. The first one, ointment. It's really essential that within the first 24 hours of an injury that the area gets cleaned and an ointment gets applied. What I oftentimes hear is keep the wound wet. It's not exactly correct. So when a wound is cleaned off, you do want to pat dry the wound. What you don't want to do is have that area completely dry out to the point where a scab starts to form too early. The ointment keeps the top layer sealed, so your natural moisture in your skin is able to help with the healing process with a couple of these steps. If you let it dry out too much, your healing process cannot come in from the side to fill in the gap, and that's when people get depressed scars, when people find, oh, it looks like there's a little scoop area. That's when this wound heals too quickly because it has dried out, is not able to fully do it. So the wet is not the ideal situation. You don't want water. You actually want the ointment on top to seal in any of the natural moisture of the skin, okay? Second step, you do want to make sure that you are keeping the wound covered. Keeping it covered has a couple functions. Number one, it prevents you from picking at it or touching it, because oftentimes as wounds are healing and scabs are forming, it will be itchy. And so during this time, having something on top will prevent you from accidentally picking off the scab or re-damaging the skin. This is pretty important, especially in the first 3 to 4 days of a wound, in that you change the coverage, which is either a Band-Aid or some gauze or some dressing, at least once a day. The rule of thumb that I like to tell my patients is if the bandage gets wet and it's a bandage that doesn't dry very quickly, you do want to replace that bandage. Again, wet moisture is not good for a wound. You do want it to be with ointment only and not really that level of humidity that you think that like a wet gauze would have. So if the Band-Aid gets wet, change it out for a dry Band-Aid with a little bit of ointment underneath. Last, no picking. So once the Band-Aid comes off on that day, third day or fourth day, make sure that you avoid scratching the area. Oftentimes, the ointment will cause a scab to form in a more slow manner, and that's actually preferred. The slower that scab forms and the slower that scab falls off, it actually allows the skin underneath to heal with the appropriate time, and this actually helps to minimize scar. So people say, oh, my scars, my scabs are taking forever, it must not be healing properly, but actually that is what you want. And so if you're able to get a scab that stays on the skin for up to 2 weeks before it naturally comes off, you will have the best looking scar there is, okay? So try not to pick at the scars, try not to help the scar come off by kind of peeling it back. These are the things that can prematurely injure the skin, and once this dry scab comes off, the wound can no longer heal, and that's going to be the final resting state of that initial wound healing. Hope this helps everyone. In summary, you want to make sure that you have an ointment on there. You change wet bandages on a daily basis to make sure it doesn't sit on top of the wound and cause infections. And lastly, you want to make sure that you don't pick at the scab so it can have enough time to fully regenerate the skin underneath. Hope this was helpful. If you liked it, please subscribe.